Hi everyone, thanks for joining us tonight. Dr. Tom Navity, Dr. Rob Farhat, and Dr. John Santana. Tonight's topic for our webinar are common injuries from motor vehicle accidents. So being in the sports medicine, pain management, regenerative medicine field, a fair number of our patients' traumas, the source of their pains, are motor vehicle accidents. So it's something through the course of treating patients over the years we've become relatively accustomed to, and we just thought we'd give a relatively high overview of some common injuries that we've seen in the clinic and how we've been able to get patients successful. So Rob, I don't know if you want to start. You kind of thought about just running head to toe for how people are injured in car accidents and what you usually see.
So the one thing is we're not going to touch on the obvious injuries, right? Broken bones, but we're talking about things that are not necessarily identified immediately. So people hear whiplash all the time, happens in the cervical spine, but it can actually happen throughout the entire spine. Most of the time it's neck, but people can have it in the low back too. But things that might be missed are shoulder injuries, rotator cuff injuries, things that go miss quite a bit are mild concussions. So people think you have to lose consciousness for a concussion, which is not the case. People will notice executive function or memory issues up to several months afterwards. But so neck, shoulder, wrist injuries, people holding onto the steering wheel, airbag goes off, or they're impacted from front or back and they're holding on very tightly. So people can develop carpal tunnel syndrome. It's not necessarily just a repetitive type injury. It can be an acute thing. And then going down, lower extremity injuries, usually not as apparent unless there's major trauma, and usually it's something is broken ankle, but people can have knee injuries, SI joint, which is part of the lumbar spine, and ankle injuries, but again, not as frequent.
Yeah. So when we talk about this, starting from head to toe again, so talking about like concussions and things like that, you don't necessarily have to have loss of consciousness, right? A lot of times, just the feeling that you got dazed or something like that would be enough to qualify as a concussion. Those typically resolve pretty much on their own, but a lot of times patients will come in with headaches, right, dizziness, sometimes difficulty with memory, things like that. So there's treatments that we could do for that. There's therapies that we could do for that. Dr. Neil Alpiner is one of our physicians who will be joining us. He does a lot of concussion type management, so it would be a good one to have. And then like what Dr. Farhat said, so with the whiplash injuries, a lot of times people have headaches, right? These occipital type headaches, kind of radiating, starting from the neck, radiating over to the head. So there's different treatments that we do for that, right? So what would you guys try for something like a whiplash injury or?
Well, usually they come in, they have a headache. Mm-hmm. So the occipital neuralgia, it's usually a good treatment within the first few weeks. It takes care of the severe headache. And then once you sort of peel away the onion, then you can determine how much is coming from the lower cervical spine versus the upper cervical spine. Things also people will notice for concussion are vision changes. They'll say, my glasses aren't as good, or I'm having trouble reading. And dizziness, ringing in the ear. So the eyes and the ears kind of work together. So those things can be annoying. The ear is not going to necessarily pick that up because their job is to save your life. So our job is identifying these things after the fact.
Which can be a challenge. So the two we've spent a good amount of time talking about, whiplash and concussion. Oftentimes imaging is normal. There's not always a glaring abnormality on an MRI or a CAT scan or an X-ray. So our expertise in physical exams, as well as details of your accident, are going to be really important. How were you injured? How was the mechanism? How fast were the cars going? All those details give us information on how the body was moved in an abnormal fashion, what structures might have been stretched too much. And I like to use a lot of, like you described, an occipital nerve block, some sort of a diagnostic injection where we get some immediate feedback from our patients, where if you're very specific about numbing up a specific area, and if that works to relieve the pain, albeit short term, that's really important because it tells us without a diagnostic image where we can say, oh, there's your problem. Your reaction to our injection can tell us that same sort of information. There's your problem, which oftentimes then leads us into a regenerative medicine procedure when these injuries aren't healing themselves in the normal timeline, using things like the platelet-rich plasma or the bone marrow concentrate or shockwave therapy or EMTT therapy, all of the different regenerative tools that we have here, then we know exactly where to focus those tools and focus those procedures.
Yeah, and a lot of times, like patients come in with a neck pain or headaches, it's the first time they're getting any type of imaging, ever in their life, right? So a lot of times it could be the imaging kind of shows injury that's maybe new, or maybe it's something you've had before, but because of the accident, kind of aggravated that pre-existing condition. So we were able to kind of look at those things and kind of weigh which are important and kind of how to treat those. So on top of the regenerative treatments, we do injections, nerve blocks, other things like that to kind of help as well.
You brought up a great point. So this pre-existing condition. So you got to think about this. Most people are driving 40s, 50s, 60-year-olds. They may have never had an issue before, and now you get in a car accident. Now they have a neck problem, they have a shoulder problem, etc. You take X-rays or MRIs or whatever, and it shows that they have degenerative changes, arthritis.
Yep.
And people are surprised at that. I didn't have it before. Well, you may have had it, but you didn't notice it, because what happens is as your body develops over time, it's a slow process. There's no major traumas, and now you add a trauma. Now that something is asymptomatic in the past is now symptomatic. That can be really challenging because there's a litigation potentially, et cetera, that makes it complicated.
Fortunately, we're pretty adept and experienced at dealing with those kind of situations and making judgment calls based on imaging we're seeing, based on symptoms, based on the patient's history. The causation is an important feature when you start talking about motor vehicle type accidents. I like analogies. One of the analogies I often use is you can have gasoline on the garage floor, but that gasoline isn't a fire until you light a match. So you got this pre-existing condition of this, exactly. Gasoline just waiting to start a fire, but that car accident was really the match that started the flame.
That's a great analogy.
But there are obvious things too. When we see MRIs often of necks and spines, we treat lumbar spines. We do a lot of spinal work here. A lot of times you'll see normal level, very abnormal level, abnormal or normal level. Well, those sort of conditions are very unlikely as degenerative in nature and much more likely traumatic in nature. So there's a lot of more obvious findings on MRIs where it's not so ambiguous whether this was a pre-existing condition or not.
So a lot of times, like when you come into the office, we do a pretty comprehensive evaluation, right? First, we talk about the history of the accident. We do a pretty comprehensive kind of see how much you remember, like what do you have, what documentations you have, what type of injuries you've had before. And then we always like getting imaging. So if you've had prior X-rays, MRIs, CTs, ultrasounds, anything, any workup that's been done prior to seeing us, those are always important to bring. So a lot of patients aren't sure what to bring. Just bring all of them, and we'll sort them out. But one of the things I like talking to patients when they come in, because sometimes in a motor vehicle accident, there's a lot of things that can be going on at the same time, from head to toe. You get injured everywhere else. I like talking to patients about prioritizing which is the worst ones and kind of ranking them up and down as to what's most important. Because a lot of times you treat the most painful area, all the other secondary things start getting better. So, and that's where all this evaluation, and that's where the key of what we do is important when we analyze our patients.
Yeah, as our specialty, physical medicine and rehabilitation, we're the right specialty to sort of analyze all these things. So sometimes people don't really know where to go after a car accident. Nothing's broken, but they don't feel right. They go to the regular doctor, etc. So we are all very familiar with these types of injuries, and sometimes asking the right question is really key, and that's really only from experience, knowing that these are the potential injuries that can happen. And so sometimes a headache may not be from your head or from your neck. Maybe it's your shoulder. So, and that's kind of the thing we do. We have to sort of figure out where the pain is coming from. We've kind of talked about this before, but so like that's what, as a specialist, that we try to do. Sometimes conservative treatment works, rest, physical therapy, medication, but sometimes not. So we have to try to figure it out, do a test shot here or there to see if it takes away the pain, and then go down that road.
Yeah, there's comprehensive treatment programs, rehabilitation treatment programs, including our specialty as interventional pain docs, but also somewhat taking over the quarterback role for the physical therapy team and the other rehabilitation specialists. In the case of a brain injury, the cognitive therapists. That's part of our training. That's, we don't get easily overwhelmed by multi-trauma type injuries. And that's a pretty common thing after a car accident. It's affected not just the musculoskeletal system, but other systems as well. And we can help steer those patients in the right directions.
Yeah. You don't need to see a specific shoulder guy, or a neck guy, or a spine guy, or a knee guy. That's all of us. We're all those guys. And then if we need more specialized care, whether we need to refer to a neurologist or a neurosurgeon or a knee specialist or a orthopedic surgeon or a psychiatrist or somebody, or physical therapy or a chiropractor, then we can manage all that stuff and kind of lead you the right direction so that you can get a more optimized, comprehensive care.
And the sooner you can come in, usually the better. Our treatments early in the post-accident phase will vary drastically from the treatments that your car accident's been years old. But even if your car accident is years old and you're still suffering from chronic injuries, those are things we can help adjust. But the sooner you can get into a rehab specialist, pain management specialist, certainly one of our team members, most likely will be able to get a better outcome for you much quicker than seeing us after 6 months to a year of failing treatments elsewhere.
Now, things that get more complicated are, say, if somebody's already had a previous accident, they get another car accident, and sort of what's an old injury versus a new injury, or if they had a pre-existing problem, like they know there was a back problem, they were seeing somebody already, and then they get in a car accident, it gets worse. Well, we're used to all those things, so we kind of know what direction to consider, but the thing that kind of gets in the way are sometimes these the attorneys and things like that, and the insurance company. But sort of our job is to take care of you, the patient. So that's what we focus on. Sometimes it gets a little sticky with these issues, but our job is to take care of you.
Okay. And then the nice thing about with the advent of regenerative medicine, a lot of times we're able to help patients get through their injuries and get better without having the need for more invasive surgeries. So we found that regenerative medicine works really well in the early phase of the injury. So for somebody who has let's say you got involved in a car accident and you have a nuance of issue, a lot of times regenerative medicine like PRP, bone marrow cells, lipoaspirate, adipose tissue, usually those work really well for those type of musculoskeletal conditions.
Let's talk a little bit more on that. So that's something I've noticed in the years that we've been doing auto accident care. The adjunct or the advent of regenerative medicine, how that's changed my thinking and my algorithm. And let's maybe just take a case example. Like somebody comes in, let's take a cervical spine pain. Somebody comes in from a car accident. What's your initial treatment plan versus, if they come in certainly like a week or two after their accident? What would your thought process be, and how might that lead to stem cell or PRP?
Yeah. So I kind of started out like any other patient I would see, right? So you get a really comprehensive history with it, and then you get the imaging. Try and pinpoint exactly where the source of the pain and the pathology is. So once we're able to find that, then we can come up with different treatment options to do. So depending on the severity of what we're treating, if it's something as easy as, let's say, a strain or a muscle issue or something like that, a lot of times physical therapy is going to be enough for that. If it's a little bit worse, or they tried the therapy and they come back and then the symptoms are still about the same, then at that point you can do like a diagnostic injection with a steroid or an anesthetic. We do it under image guidance and really pinpoint the area where you think the pathology is, treat that area and see how much of an improvement it gets. As you know that from these injections, it's a temporary treatment. So it's helpful in that it helps us diagnose and figure out the exact place to treat. Once we know what the main pathology is, then your treatment options expand, whether it's going to be a surgical case, or if it's not too bad, or something that we think regenerative medicine can treat, either PRP or stem cells, then that's the option that we would take. More often than not, patients that don't really have any severe surgical issues or pathologies, regenerative medicine work really well with it. And you have your options with PRP, you have your options with bone marrow aspirate and lipoaspirate, and these things really respond to issues in the cervical spine, respond really well to that.
Another point too is maybe it's not bad enough for an intervention. Maybe you don't need an injection. So we have these sort of superficial treatments that we could do here, the ENTT, the shockwave. And those in the early stages can make big differences in treatment without getting a needle. Some people are a little needle phobic, right? So we have other options that are available that don't involve getting poked with a needle. But sometimes it's, if the problem is severe enough and those conservative treatments aren't as effective, then we always have the alternative.
Yeah, it's I really like our approach to medicine and to patients because it is individualized. I've had patients who I outlined, you know, they were just in a car accident. Let's start with some physical therapy, and they're doctor, why wouldn't I just do the PRP? Isn't that the best? Well, yeah. It probably is. You're right, but just as a physician, you know, we tend to start conservatively and move towards the more invasive and interventional things. But the risk with the PRP is almost nothing, in good skilled hands. You know, the PRP comes from the patient's own blood, so they can't be allergic to it. So in those situations, you know, I kind of look at the patient like, hey, you're right. If you wanted to do the PRP straight off and then rehab it afterwards, there's no harm in doing that either. It's just probably not the normal conservative treatment plan that we take most of our patients down, but there's no reason we can't. So we really do try to take an individualistic approach to our patients, and it's not just here's your algorithm, get in line and do A, B, then C. And if you're suffering from any kind of injury from a car accident, we'd love to take a look and see if that's something we can help with.
Yeah, that's a good point too, because the good news is with these car accidents, at least for now, these regenerative treatments are covered. So it's the only insurance right now that's covering. So I've been in situations where someone said, I don't really want a cortisone. I don't want a steroid shot, right? Yeah. So I'm like, well, PRP is perfect.
Or I don't want surgery.
Or I don't want definitely surgery, obviously. So we have the alternative, natural treatment strategy.
It's been a great adjunct to my practice, and it's, I think, helped a lot of patients who otherwise would be stuck in a chronic pain cycle, having, you know, invasive, risky surgeries, or otherwise continued disability from their auto accidents.
I don't know too many people that actually want an operation. So
or being poked and prodded continuously because these blocks are just temporary treatments.
Exactly.
So yeah, we'd love for you to kind of come by if you were involved in a motor vehicle accident, or if you have any sort of pain somewhere in any part of your body that you just want to have it looked at, evaluated, and see what we can offer for you. We'll be more than happy to come see you. Give us a call here at the Michigan Center for Regenerative Medicine, 248-216-1008.
Appreciate it. Thanks for tuning in, everyone.
Thank you.
All right. Night.